Dyslexia is a language-based disability derived from differences in brain structure and brain function. The cause of dyslexia is believed to involve both genetic and environmental factors.
What are the causes of dyslexia? That's a really good question, and there's a great deal of research ongoing to find the answer to that question. Certainly there is a heritability. Dyslexia runs in families. If parents have dyslexia, there's a better probability that children of those parents might also have the disorder, but it's not necessarily the case, and sometimes even though they may have dyslexia, the manifestations or the characteristics could be different. There are also children in families who have dyslexia who don't have that family. They're looking at particular genes, and the jury is definitely still out on that. There's been a lot of progress, but there's been no defined gene for dyslexia, and part of the reason for that is that reading and written language are such complex tasks that they involve a network of connections in the brain, not just in one area. And so that's one of the reasons that is probably taking a bit of time. So as far as the cause, and it's not a disorder that you cure, it's a condition. It's a physiological variant or a neurobiological variation. It's not brain damage, it's a different kind of brain functioning. The brain works in a different way or learns certain things in a different way, speaking specifically language in a different way.
A pregnancy can be complicated by various congenital infections in the child when the mother has got various bacterial, viral, fungal and parasitic infections during any stage of her pregnancy. And these infectious diseases can deform the child, as you know, in congenital toxoplasmosis or congenital rubella syndrome. But then the child will have mental retardation, the shape of the skull may be small, called microcephaly, and multiple defects can happen. Whereas the child subsequently developing dyslexia is apparently normal at birth, and therefore we cannot attribute any gestational infections for the cause of dyslexia. The multifactorial theory about the genetic diseases have been studied in detail. Even though one single abnormality cannot be postulated, there have been studies where an abnormal gene on chromosome number 6 and 15 have been attributed to one of the postulations to the causation of dyslexia. So when a child with dyslexia attends the school, he requires special concern because of the abnormalities in learning. He will be not necessarily a school dropout, but cannot compete with the stress of education, especially the present day education. So the teachers as well as the parents have to have adequate counseling that the child should not be scolded, and the disease should not be labeled as a disease as such, because it should not lose the confidence of the child as well as the family. Now, environmental factors. There are so many neurological diseases affecting pediatric intelligence, where heavy metal poisonings, abnormal signals from the environment can damage the brain of a child. But specifically any particular metabolic abnormality or a particular biochemical abnormality has not been ascribed to the etiology of dyslexia. Dyslexia, can it exist alone, or can it be combined with other diseases? This is the concern where a neurologic consultation will be most helpful, because 15% of dyslexics will have associated disease called attention deficit hyperactivity disorder. That is a different disease with different causes, and there are specific treatments directed for the attention deficit hyperactivity disorder. Conversely, 35% of children with attention deficit hyperactivity will have features of dyslexia. ADHD has been studied in detail, and there are drugs like cerebral stimulants, specifically methylphenidate, and certain new drugs which are available for the specific treatment of ADHD. But as such, there is no drug which has been discovered exclusively for the therapy of dyslexia.
Yeah, so at what age can we actually find out if children do have difficulties with reading and writing and maybe dyslexia. As with many other things, the earlier we actually help the child, the easier it is to compensate for the difficulties they have. So usually in kindergarten already we can see that the child has problems with defining sounds in words and with writing down words. When they write, their writing doesn't actually make sense. They do not write the sequence of sounds, but they may write just letters jumbled up. Often the letters are similar to the ones in the word, but they do not follow the right sequence. That tells us that the child actually has not written down the sounds, but tried to memorize the word. So we can help these children very early by systematically teaching them the individual sounds. I see children from the age of about 5 years because at this time it has become clear that there is a difficulty. Now the importance of finding out the difficulty is because we need to address the problem. So children who have reading and writing difficulties may not necessarily have dyslexia. In the sense there may be a general developmental delay, they may have difficulties in understanding the instructions the teachers are giving, they may have difficulty in understanding the language in general, they may have difficulty in their overall development.
Dyslexia symptoms can be difficult to recognize before your child enters school, but some early clues may indicate a problem.
In dyslexia, the things that have to be careful is how you are able to assess the daily, weekly, monthly or annual progress of this child. The child will attend school, he will run, he will play, he will participate in sports, but only when it is coming to the reading and writing areas, he will have problems. But obviously in our system of schooling, obviously there are written examinations and readability tests where the child will fare poor compared to his peers.
Once your child reaches school age, your child's teacher may be the first to notice a problem. The condition often becomes apparent as a child starts learning to read.
Characteristics of dyslexia differ, of course, within individuals, but also at different ages. So I think I mentioned earlier that with younger children it may be a difficulty in rhyming or remembering the names of things. Once they get to school, they may be having difficulty with reading words or spelling words or writing letters or remembering the names of the letters and the association of the letters and the sounds. And as they move on, there may be some students are pretty good at memorizing at the very beginning, so they may memorize enough words that no one has recognized that there's a reading problem, but their spelling usually still is good evidence that they're having difficulties. If they don't understand why the words that they've memorized are pronounced the way they are, they have no information to use for spelling those same words. And where reading requires recognition memory and has the context of what's being read to help them guess, not a good strategy, but sometimes the only strategy they have if they haven't been taught appropriately. They don't have that to use when they're spelling, because spelling is a retrieval and it may make perfectly good sense to spell a word incorrectly if you don't have all the information you need to make choices. And as the students move through, sometimes students are not diagnosed until they're even in teenagers or in high school or sometimes even college. And there have been parents who were diagnosed when their own children received the diagnosis, parents who had the difficulty all the way through but didn't understand what the problem was. So the earlier the diagnosis, the better, because early intervention provides the most evidence for good prognosis, but it's never too late, and students who haven't received help until they're adults can still learn to do what they need to do and learn to do it well.
Dyslexia exists across all societies. and it does not depend on what particular language people are speaking. However, obviously the particular manifestation, the way it presents itself, is dependent on the languages children are speaking. The reason why some people do have this difficulty is not because there is any deformation or anything that's not normal in their brain. They're perfectly normal in the sense they're like everyone else in other respects, but this ability to distinguish sounds in words is actually something we only need for reading and writing. To do that efficiently is not important for understanding of language, but it is very important in the alphabetical systems of reading and writing. Most reading and writing systems in the history of humanity before the last 2,500 years were symbolic based, like the Egyptian writing and like today still Chinese language is. So they actually had real pictures to describe objects and ideas. It's only with the introduction of the alphabetical system we had to develop, or humanity, the people who are living in these societies, had to develop the ability to clearly distinguish the sounds in words and associate them with symbols.
One question that often comes up is, do people with dyslexia see the print differently than people who don't have dyslexia? And based on research, the overwhelming results of research indicate that people with dyslexia see things the same as everyone else, but they need help with figuring out how to translate the code, the visual code, the graphic symbols into sounds. So if they see a letter, say a B, a D, a P, and a Q, if you think about that, if you had a cup with a handle and you turned it 4 different ways, it would still be a cup. But if you change a B, a D, and a P, and a Q, they change only in the same way that that cup would, but the name of each of those letters is different. And so students with dyslexia may need a way to sort out which one is the one that's a B, which one. So to teach them, for example, to say, for the B, tall, stem down, up, out from my body if they're right-handed, that's a B. Whereas if it's a D, the round like an A, round like an A, and that's a D, round like an A, D. So if they see the round like an A part first, then they know that. If they see the tall stem down first, they know that that's a B. And that's another way using the kinesthetic. So it's not that they don't. Language, as I said earlier, is integrating several different modalities. So the vision gets the information in, but it's the language processing parts of the brain, the auditory and kinesthetic areas, that are dealing and processing the language. And it's teaching them to integrate what they see, the visual symbols, with the auditory sounds, or integrating from the auditory sounds to the visual symbols that are associated with them for spelling and for reading. And it's teaching reading and spelling together in an integrated way, so that they're not having to memorize anything, that they're learning how to figure out what they need to figure out, rather than just memorizing and not understanding how it works. So it really is teaching them the structure of the language at all levels: the phonology, the phonics when you get to letters, orthography, the spelling patterns, morphology, the meaningful units, etymology, and of course the syntax and the grammar for reading comprehension and vocabulary.
There is no medication, there is no medical intervention, but there is a remedial intervention which is based on understanding what the brain is doing and systematically teaching the children the skills to develop good reading and writing. There is no cure, in the sense that there is nothing that we can change which will, from one day to the next, enable them to read. There are some people who try to sell some cures for dyslexia, but unfortunately this is not the case. However, the right type of instruction to practice and to continuous application of multisensory ways of teaching will help the children to develop appropriate reading and writing, and it will not be anything which will make their life more difficult.
People with dyslexia can learn to read, write, and spell as well as anyone. The earlier the intervention occurs, certainly the better, because if students get help in kindergarten and first grade, they don't have to feel those unpleasant feelings of not being able to do what their classmates are able to do. But it's never too late to teach them, and they can learn to certainly read as accurately as anyone, sometimes better than peers, because they don't have to guess, because they really do learn how the language works. They learn to comprehend at the highest levels. They may read at a slightly slower rate than their peers, but they can read and do anything that the rest of their and I personally have students who have graduated from the best universities and are in graduate school. Some of them are physicians, lawyers. They're doing just fine. They work hard, but that's part of who they are, that work ethic.
Many parents ask themselves if dyslexia, or if their children have reading and writing difficulty, if there actually is a problem that they are not normal. Dyslexia has nothing to do with being normal or not normal. It is simply a difference in processing of certain parts of information, and people with dyslexia are perfectly normal. If they're taught the right way, children can also develop reading and writing as functional as anyone else. The only effect it may be that they read a little bit more slowly, or that their writing takes a little bit more time. But otherwise, once they are given the right type of instruction, the remedial specific instruction, then they will learn how to read and write.
Each child is a gift in this world. What we have to contribute is a healthy family, healthy nutrition, health education, compassion and care. We have to see that each child develops into a good citizen in our country.